Hello everybody, time for round two. So this will be the second video update I'm being able to give. So super happy to be here today to give you an update. Had a great board meeting, got a lot of progress that is happening around the organization. So I had to take quite a bit of notes because a lot of stuff I need to share with y'all today, but kind of the topics we're going to cover today is really another update on debt reduction just to keep y'all all informed on where we're at. Really one of our operational key performance indicators, and you probably had your leaders talk about that, and I'm going to give a little insight to that and why we're going to start to measure those things. Program development, we're going to start out with orthopedics as our first program that we're going to be developing, and also give you some highlights onto why that's important and how that will impact our patients, our community, and us as individual clinicians that are taking care of these patients. Then I want to talk about internal strategy and external strategy. And so as we start to think about, as we're building new programs, as we are starting to, in essence, rebrand ourselves in the community, kind of how we sequence and what that sequence needs to take place. And then when we think about, improvements, how do we tie benchmarks and improvement work that is going to start to happen and is currently happening to a degree, and we're going to increase that across all of our departments. And then the last thing would be just to kind of share where we're at from a turnover standpoint, because we've got some really good numbers, which is super exciting. So on the debt reduction piece, we're about a little over old debt, about $8.4 million. And huge, massive improvement when we think about, less than 16 months ago, there was an old debt that was about $32 million. So super excited about that. The goal for us is, the plan is that we will have all of that debt actually paid off by sometime in April is kind of our target date. And hopefully if we can make it happen faster than that, we will. And of course we will celebrate that when that happens. The second thing I want to talk about is really operational key performance indicators and how we compare that to national benchmarks. And so as we think about our operational performance, our clinical performance, we need to, one, we all come to work, we want to do an excellent job, but we also need to have some kind of barometer, right, that helps guide us and show us that we're doing it as good as we can do it. And not to say that as we continue to have processes and we develop new things, right, it is an organic process, and we're constantly striving to make that better and better and better, and we should always do that. When we think about healthcare, right, we're lifelong learners, and we should be, because things change, right? And so we have to change and adapt with those. And so as we look, we have about 100 key performance indicators that are across the whole organization. And what we do is we look at our individual performance on things that our tasks, our processes that we're doing within our departments. And then we really want to compare that to kind of best in class nationally. And so we pull benchmarks that kind of give us an indicator or like a barometer to tell us how close are we to that. Are we above it? Which, yay, we want to celebrate that. Or do we have opportunity for improvement? None of that is bad. So, when we think about a learning culture, or we think about a healthcare organization, there is always opportunities for us to make things better. And so where we have to make sure is, we need to look at the things that are the biggest impact for us, whether it is operational efficiency or it's clinical care that is going to drive improvement to the patients that we're serving. We need to figure out how do we strive towards best in class, and this is a way to accomplish that. The next thing is really the program development. And so just like I was talking about, orthopedics is going to be the first one that we're going to tackle. When we think about programs, we do orthopedic surgery, right? We do fractures, we do total knees, total hips, some sports medicine, and so that is happening today. But when we think about a program looks at the patient and it looks at their whole continuum of care. So it's all the stuff that kind of happens before surgery, and obviously the things that happen when the procedure is actually taking place. But it then is all the stuff that happens after surgery until they really kind of get to where they're almost back to where they were pre-surgery. And so as we think about a whole bunch of patients coming in and having the same procedure, what can impact that in a negative way is if we have variation. And so with having a path, right, a program, set processes, set protocols that will take that patient, no matter what their background is, and if they have a total knee, they're going to go through the process just like everybody else would. What ends up happening is we refine our ability to take care of that patient. And we also, by taking out variability, we end up taking out that variance, which this then can contribute to complications. And so our outcomes get better and better and better. So as we're starting to develop these programs, what we want to do is we get the program developed, we start to really measure that, because we want to start making some of these programs and start striving for centers of excellence. And again, back to benchmarks. We want to be, when we think about our outcomes, and all of us, right, this community deserves that. All of us deserve that when we come to get care here at Rehoboth, that we want to have the best care possible. And there is no reason why we can't have the same healthcare delivery that you can get in a bigger city, right? And so that's kind of our mission, right? We need to serve our community, and the service that they get needs to be top notch. Well, we have to build that, right? And that's going to take some time, and that's going to take collaboration, right? That's going to take partnership with all of us internally and with our providers in order for us to get there. The next thing is community involvement. And I just want to kind of give you an update on that, because as we think about all the stuff that's happening internally with all of us, and of course we live in the community, how do we really connect with a lot of our community leaders, community programs, and how do we figure out how to make those partnerships richer? And how do we also figure out where some of the gaps are, right? And how do we fill those things in? And so we're going to continue to be reaching out to that, not just myself, but the whole executive team. And how do we learn to enrich those? We'll probably do some projects. There will be lots of different things that will happen at different times depending on the need, but we want to grow that. In growing that is going to impact the care we deliver, but part of that is by partnering with people, it makes the loads easier, right? We're not dragging, all this weight on our shoulders trying to go up the hill. We're spreading that weight out, and it allows us to reach wider, and it also allows us to be more effective, and it allows us to actually be able to do the job better. So now we're going to talk about internal and external strategy. So as we think about program development, starting new services, when we start those things, one, we want to make sure we're prepared for it, and that we've got people trained, we have all the processes, everybody knows what their role is. But when we start really improving some of these outcomes, especially in some of these new product lines or service lines, when we feel like that, we're consistent and we kind of have it down pat and we're comfortable with it, we want to start promoting that externally. And so you will see, Rhonda and her department within marketing, that there will be a strategy that'll be tied to communicating changes, things that progress, wins that we have. As we start to move the needle on things, we want to communicate that to our community. But that will only happen after we feel like we've got these things solid, right? We want to make sure that we clean our backyard up, right? That we make sure that looks good and pristine before we're starting to kind of, publicize that or have somebody over for dinner. And so internally, you're going to start seeing this stuff, just like I'm communicating with y'all today. As we start to build things, as we start to have wins within different departments related to key performance indicators, we're going to share that internally. That may happen for months. until we feel like we're at a place where we are going to start to really publicize that kind of to a larger audience. So super excited about the improvements we're going to be able to make, and super excited about the journey that we're all going to be on together. Lastly, I want to talk about kind of the year end. So when we think about, we just finished 2024, and looking at kind of, when we think about annualized turnover, we think about 90-day turnover, and we think about our vacancy rate, all those things are indicators that are tied to retention. And so when we look at year over year, our annualized turnover rate just in 2021 was 24%, 28% in 22, 26% in 23, and we hit 17% in 24. So that is huge for us. I mean, we've almost cut it in half. That is massively significant. The other thing is the 90-day turnover. So, a new employee comes in, and that 90-day turnover is a pretty good indicator that we are kind of missing the boat, right? That we're maybe not welcoming people, we're not giving them the tools that, those are indicators for us that we want to make sure we're doing well. For 24, it was 2%. So incredible numbers. Not to say that we're perfect, we know we're not, right? We are in the process of really developing way more structured orientation programs. For instance, we know that in order for us to be successful, somebody that is going to be taught, right, and we call those preceptors, we need to have consistency, right? We need to arm those preceptors with the right tools to be able to be consistent and train new employees. So that program is going to gain a lot of traction and a lot of teeth. The second piece is when we bring in new graduate nurses. I am a nurse, so I remember that. It was a long time ago. But, when we come out of school, we know basic nursing. And there's lots of things, because every hospital is different. They're not all the same. And so when we think about that GN orientation or that new graduate orientation, there needs to be an actual kind of fellowship with that. And so that is going to be rolling out, that it'll probably be around 5 months. There'll be didactic as well as lots of hands-on exposure to the clinical area, so that when we release those new nurses, they're really going to be past that novice, and they will feel comfortable to step into their new role as a registered nurse. And so those are just 2 programs. We're going to be looking across the organization for us to impact that. So my point with kind of sharing that with you is we've done really, really well on turnover, but we want to do even better. And we want to look at those retention rates and that turnover rate and what we actually have as far as people's overall satisfaction with their job working here. We want that to continue to rise. And so in order for us to do that, right, we've got to start making sure that we kind of fill in some of these spots. So huge amount of information, but excited to share it with you, and very, very happy to be here. And thank you for all the work that you do.